Welcome to the High Risk Pregnancy Training Academy, where ANMs, medical officers and specialists come together to learn about high-risk pregnancy conditions, share experiences and work together to ensure the best health outcomes for mothers and babies. Today, we're learning about the identification, treatment and management of the high-risk pregnancy condition of gestational diabetes in pregnancy. But first, let's meet our expert trainers.
Hello everyone. I am Dr. Karishma Tharyani, a senior obstetrician and gynecologist. Today, I shall be discussing about gestational diabetes mellitus. Gestational diabetes is any diabetes that is diagnosed for the first time in pregnancy. Like any other type of diabetes, it impairs the body's ability to metabolize the blood sugar. This increase in blood sugar level can have adverse effects on maternal and fetal health. Did you know that the prevalence of diabetes in India is one of the highest in the world? Despite of having such high numbers, we still don't have proper diagnostic and management protocols in place. So today, to know more about gestational diabetes, its effect on the health of the mother and the fetus, its diagnosis and management, we have with us Dr. Poonam. Dr. Poonam is a senior consultant, maternal and fetal health at CFMC New Delhi. Welcome, Dr. Poonam.
Thank you, Dr. Karishma.
Dr. Poonam, please can you tell us how does gestational diabetes affect the health of the mother and the fetus?
So, gestational diabetes, as you have already told, means increased sugar in the blood of the mother. It has an impact on the maternal health and the fetal health. So, with respect to the maternal health, the lady can have increased chances of having infection, particularly urinary infection. The lady also has increased risk of a cesarean section, and such women later on in their life, when they are in the 40s and 50s, have an increased risk of diabetes type 2 throughout their life. So, these are the implications which gestational diabetes can have on the maternal health. As far as the fetus is concerned, the baby gets enough sugar in the blood, and therefore these babies can grow more in size, resulting into what is called as a macrosomia. So such babies can also have difficulty in birth because the shoulders increase in size, and therefore the birth injury chances increases almost double as compared to the rest of the population. And these babies, once they are delivered, can also need to go to the special care, which is the neonatal intensive care unit, almost to the tune of 4 times more chances of spending some days in the NICU. So these are the few implications that diabetes can have on the maternal and the fetal health.
These are all very serious sounding implications on the health of the mother and the fetus. So this makes the diagnosis of this condition of utmost importance.
That's very true.
Are all women at an equal risk of developing gestational diabetes, or are there some women who are at a higher risk?
So there are women who are at higher risk, and these include the ethnicity, which is us, like we are Southeast Asian, and we are more of a risk as compared to the Westerners. Similarly, if the lady is high BMI, or has a history of a hypertension or thyroid, these are the women who are more of a risk of getting gestational diabetes. Similarly, if the family history is suggestive of a diabetes in their parents or grandparents, or of hypertension even in the family, again these women are more of a risk of having gestational diabetes.
Dr. Poonam, you very beautifully highlighted the points on history and the high risk factors that we need to look for. Are there any signs on examination that will help us in diagnosis?
So after taking a thorough history and defining the high risk factors, antenatal examination is very important. It starts from the blood pressure recording, and then looking at the women completely, making sure that the weight is documented, there is not increase in the weight considerably, and then examining the obstetric part where you can see that the baby is growing too much in size, for which a referral has to be made. So all these examination is needed, and then every woman irrespective of the high risk, needs to go for the screening for gestational diabetes, which is in the form of OGTT with 75 grams of glucose.
What is OGTT you're talking about, Dr. Poonam?
So OGTT is the oral glucose tolerance test, where a defined amount of sugar, which is about 75 grams of glucose, is given in 300 ml of water, and then the sugars levels are checked 2 hours after.
Okay, and on the basis of what the sugar levels are, the further diagnosis can be made.
The further diagnosis and the management.
Dr. Poonam, you explained to us how to do the OGTT test. Now, once the ANM or the medical officer has done the test, how will they interpret the report? How do you make a diagnosis on the basis of this test?
So once a 75 gram of glucose is taken by the lady and 2 hours after the blood sugar is taken, if the sugar levels are more than 140 milligrams per deciliter, one should start thinking about diabetes. Less than 140 milligrams per deciliter is normal. So between 140 to 200 is when we classify it as gestational diabetes, where a good checkup of the blood sugars is needed. Anything above 200 milligrams per deciliter becomes an overt diabetes. Any women who comes with the fasting sugars more than 126 milligram per deciliter, again is considered as a diabetes. Or if the HbA1c, which reflects the last 3 months of the sugar, is more than 6.5%, is diabetic.
You have told us about the implications that diabetes or gestational diabetes can have on the health of the mother and fetus, and they're all very serious implications. So once a medical officer or an ANM diagnoses a woman with gestational diabetes, can they manage such a woman in the primary health center, or are all women who've been diagnosed with gestational diabetes are to be referred to a higher center?
If it is the gestational diabetes, which we mentioned is between 140 to 200, we can do it at a local level, the management, because these kind of women can easily have the sugars well under control if they understand what kind of a diet they take, if we do work on the diet and also the exercise. It can be thought of that metformin may be of a good help in the interim period where the women is trying to get her sugars better before referring her to the tertiary center.
Dr. Poonam, you just said that most women who suffer from gestational diabetes will not require any further management beyond diet modifications and exercises. Can you please elaborate on what these diet modifications are, or like you said, the medical nutrition therapy?
So the medical nutritional therapy includes a balanced diet. This diet should be attuned to the local eating habits which the healthcare workers are aware of. Predominantly, it is the complex carbohydrates, which should be about 50% of their diet, followed by the proteins, which should be about 30%, and the rest could be fat. So the emphasis should be more on the proteins, the fibers, the fruits, milk, the poultry products, etc. The exercise also needs to be done in a disciplined way, and everything needs to be documented in their handheld notes, the MCP notes that the women carries with them. The exercise includes walking, is a very good exercise, 30 minutes of walking every day, predominantly after eating, after each meal is very important to get the sugars into the normal range. Exercises like flexion extension of the arms can also be helpful. So exercise along with the diet is going to be important in managing gestational diabetes in pregnancy.
This is a very valid point that you have made, and it is very important for our healthcare workers to understand that just asking a woman to modify her diet is not enough. You have to help her by telling her about the local foods that she can include in her diet and how that food should be distributed in her plate. For example, most of our Indian diet is carbohydrate based. We will have a lot of rice or chapatis with very little amount of dal or any other protein. So it is very important that the woman is taught on one-to-one basis how to divide the different types of food items based on the local produce which is available.
The role of MNT and exercise is to give adequate nutrition to the lady, making sure the sugars are in the normal range, and also the women gains adequate weight gain as is needed in the pregnancy. Both of these, that includes the MNT and the exercise, can go on for 2 weeks, after which the pregnant lady needs to follow up with the ANM or the medical officer.
So, Dr. Poonam, like you told us that once the ANM diagnoses a woman with gestational diabetes, she can start her on medical nutrition therapy and exercises, and then call her for follow-up after 2 weeks. So, after 2 weeks, how will the ANM know that the patient is responding to the medical nutrition therapy and doesn't need to be given any other treatment?
So, after the lady has had the MNT, which is the nutritional therapy, and the exercise, the sugar levels will be checked by the midwife. If the fasting is less than 90 milligrams per deciliter or the postprandial less than 120 milligram per deciliter, these are normal values. It means that the lady has been compliant to the MNT and the exercise, for which she should be reassured, and the counseling should be that she should maintain what she's been doing and follow up again in the next 2 weeks' time. Should the fasting be above 90 milligrams per deciliter or the postprandial more than 120 milligrams per deciliter, these are the women who needs to be recounseled about the diet and also about the exercise, and to be making sure that she is compliant to the advice that has been given. Any blood sugar level which is above 200 milligram per deciliter has to be referred to the tertiary care center, as it's an overt diabetes.
Ma'am, so are there any other circumstances also besides the rising blood sugars that an ANM should know so that she can refer the patient on time to the medical officer?
So, any symptoms which is gone, different symptom which the patient is getting, like recurrent urinary infections, or if the patient has developed hypertension which is above 140/90, or the ANM notices that the symphysiofundal height is more than what it should be, these are the women who again needs to be referred earlier than later to the tertiary care centers.
This brings us to the end of Film 1 about the identification, treatment and management of diabetes in pregnancy. Please watch Film 2 to learn about the protocol that should be followed by medical officers and specialists for management of diabetes in pregnancy and in the postpartum period.